The content of this video is not medical advice or a substitute for physical therapy. Please consult your physician or physical therapist before starting any exercise program.
Today's tip is part one of a three-part series I'm going to be doing for you over the next several weeks so that you can improve rotation without provoking back pain. This is especially important for golfers, tennis players, and other rotational athletes that may have injured their back in the past or maybe just want to avoid chronic low back pain altogether. So tonight's tip, part one, is going to focus on improving mobility in our stiff places, and ideally avoiding moving unnecessarily through the lower back. So for our first exercise, you're just going to need a pillow, and you can just lie on your side here, put your head on the pillow so that your head and neck are aligned. You're going to bend your knees and hips so that your knees are below your hips. Knees are stacked, hips are stacked. You're truly on your side here. Now you're going to take your top hand and place it on your head and keep your elbow pointing forward here. Take a breath. As you exhale, keep your knees together and stacked and rotate your head and shoulders back a little bit. This is inviting your whole upper back, your thoracic spine to rotate. Pause, take a breath, and exhale again to return to the front. So notice that I didn't let my elbow get away from me here. That could put unnecessary, irritating sort of feelings into that shoulder blade on that side. And I also wasn't trying to crank my head around. This is about upper back mobility, not neck mobility and not shoulder. All right, so we're going to do that again. Take a breath in, exhale to rotate just through the upper back, pause, take another breath, and then exhale to return. Now, ideally, you do 3 of these before you change your hip position. So once you've done your 3, you're going to move your knees up to where there's a right angle at your hip, and then you'll take that top hand, place it on your head again, and exhale to rotate. So same movement pattern, new hip position. I want you to do 3 in this hip position, and then you're going to bring your knees up one final time, not rounding your back any more than absolutely necessary. So we want the back to be as straight as it can be with your knees up high here. Hand goes to the head, and you're going to exhale and rotate those shoulders back 3 more times. Now, depending on how stiff your upper back is, you may only do this on one side, which would be your more restricted side. That means you would have one side that feels highly mobile, you can move it easily, and one side that feels stiffer. So you would rotate on the stiffer side to improve mobility on that side. If you feel stiffer in general, then make sure you do a more balanced approach and do these rotations on both sides. Now, before I move on to my second exercise, I just want to remind you that if you like this content, please share it with your family, share it with your friends. We really appreciate your help in getting the word out to more people so we can help more people. All right, now let's go on to our second exercise for the evening. This exercise is a mobility exercise for your hips. And in this situation, I want you to just place your hands behind you with your knees bent and your feet on the floor and get as tall as you can through your spine. So you can press with your hands a little bit and lengthen your spine, and then you're going to allow both legs to rotate to one side. Now, if you feel like this is jamming you up, you can walk your hands back a little bit, keeping your spine as long and straight as possible so that you have room in your hips to rotate from side to side. You're going to hold for just a moment, and then you're going to change the rotation of the legs and the hip joint. As you become more mobile in this pattern, you can start to walk your hands back up towards your hips and enjoy the increased challenge of a straighter back and a more closed hip position. All right, that's it for our tip today. I hope you enjoyed it. I hope it's helpful to you. And until I see you next week, keep moving and be well.